and welcome into Your Health. And I want all of you to listen up, men and women. We have with us, and we're so fortunate to have Dr. Pam Strickland. Dr. Strickland has been doing breast surgery in Montgomery for a long time and is absolutely phenomenal. Everybody that goes to her loves her, and she is here taking her time to help teach us what we need to know about breast cancer. And Dr. Strickland, thank you so much. And we were talking earlier, the things that we need to be looking for, and this includes men and women. Men can get breast cancer too.
Yes, that's true. And I think for a lot of men, it's not something that was ever anywhere on their radar to worry about breast cancer, but men can get it. It's, of course, far less common than it is for women, but especially if a man has a family history, a strong family history of breast cancer, then they kind of just need to pay attention to what's going on. They don't necessarily have to do mammograms every year like women do, but they need to at least be paying attention to if there's a lump or something there. So
what is it that we need to be doing to be aware that we might have a propensity toward that, or just examinations? What can we do to catch it early, because it's so curable if it's caught early? So all the things that every one of us need to be doing.
Well, I think it's actually a two-part answer to that.
Okay.
So the things that you need to be doing would be getting the mammogram. I mean, I think a lot of women are afraid to get a mammogram because they're afraid it's going to show something, or because it's uncomfortable, because there's a lot of compression on that tissue when they do the mammogram. But with mammography, we can usually detect things early, catch them when they're very small and at their most treatable stage. If you looked at all the women in our country who die of breast cancer in a given year, 75% of those women were not getting regular mammograms.
Wow.
So those are, if you're not
That's
paying
a high
attention,
percentage.
Exactly, then it's definitely something that you need to be aware of and paying attention to. We've kind of stepped back a little bit from saying women need to do a breast exam, a self-breast exam every single month. It's really, what's more important about that is not that you do it every single month. It's just really more important that you have a good feel for what the normal is for your breasts. Because breast tissue by nature is very lumpy feeling, and if you don't ever check or pay attention to it, then you wouldn't have any way of knowing if something is new or if it's been there for a long time. So just self-breast awareness is kind of what we focus on these days. As far as risk factors, what a woman needs to know about what her risk is, there are some things that I think most women are somewhat in tune to. For instance, a family history.
Right.
Usually we're not talking about people who have a maternal great-grandmother or, on their mother's side with breast cancer. We're talking more about close family members, or if there are multiple generations in your family that have been affected. Those are things that could certainly increase your risk. But there are a lot of other factors, some of which we have no control over. For instance, we don't have control over family history or any type of genetic mutations and things like that. The things that we do have control over are things that are good not only to lower your risk of breast cancer, but just for your health overall. And these are some of the things that are really simple in concept, but not necessarily easy to do for many people. For instance, maintain a healthy body weight, especially after menopause. Weight gain after menopause significantly increases the risk of breast cancer. Making sure you're getting regular exercise. I mean, our studies have shown that regular exercise in breast cancer survivors can significantly lower their risk of having a recurrence.
Wonderful.
So the
Great.
exercise part, it doesn't have to be joining a gym or running a marathon. Even just a good brisk walk, but done on a regular basis. The recommendation is to get 150 minutes a week of exercise. Okay, so that, you could break it down and do 30 minutes 5 days a week, or an hour on Saturday and Sunday and 30 minutes some other time in the week. I mean, so it doesn't have to be very prescriptive in that way, but just routine, regular exercise, and eating a healthy diet. It's something that's focused more on fresh fruits and vegetables. Doesn't mean that you have to become a vegan or do anything drastic like that, but it's really more about your balance over time and not what you do on one day.
When should women start getting mammograms? At what age?
Well, that's almost like a trick question these days, because there are different organizations, different medical organizations that make different recommendations as to when a woman should start getting mammograms. There are some organizations that would suggest that women can wait until their 50s, but the American Cancer Society recommendations are that a woman between the age of 40 and 45, that it should be based on a discussion with her physician as to what her risk factors are and whether or not she should go ahead and get started. And then at age 45, definitely would recommend yearly mammograms in women after age 45.
Okay. So there's no age limit where you stop. If you're pretty healthy, and you should do that. I know that we are all into preventative medicine, and I cannot thank you enough. And please, folks, take care of yourselves. Take charge of your own health. There's so much you can do. And thank you, Dr. Strickland, for being with us. And you may have saved a life today.
Well,
thank you. And we'll be right back.